Kia ora, my name's David Collins. My wife Tanya and I started the Pipe Down lobby group back in 2014. This was to effect change when dealing with the unique challenges presented by the drug methamphetamine. A year later, 2015, we opened the Red Door program, which over the last 9 years has grown and is enjoying a pretty high level of success. And I think there are some key reasons for that. One is relatively low client numbers. That has obvious benefits. There's nowhere to hide. Two would be the 2-year aftercare commitment. That's a critical component of the program. And also we try the best we can on assessment to only accept people who are absolutely genuine about turning their lives around. We get people from all walks of life, from across the board. We've had health professionals, lawyers, corporates, and way through the scale to people who may have done a bit of prison time, and that might be for the likes of recidivist drunk driving or small-time dealing, for example, to support what can be an expensive addiction with the likes of methamphetamine. So we're looking at a new program now. It's called Reset for Life, and we're hoping to garner support for this. It is essentially an alternative for prison, whereby, for example, somebody who's got a sentence of 2 to 4 years, and where there is a direct link between the crimes and the addiction. And the question is, could an alternative have a better outcome for these people than prison? And we think the answer is yes. So the Reset for Life program is all about breaking a recidivist cycle. And that cycle, we see it every day over and over. It begins with addiction. That results in a need for money. That results in crime. And that results in prison. And that cycle is on repeat. Now, for some perspective on this, a meth addiction could cost $1,000 a day, and that's a lot of money to find on a daily basis. So the outcome is fairly predictable: crime. And so goes the cycle. Now, while there is current talk about tougher sentences, which will be supported by many in the community, tougher sentences will only delay the cycle. It won't end the cycle. And that is exactly what Reset for Life plans to do. How bad is this recidivist cycle? The latest figures from corrections show that 68% of younger people under 24 years of age who are sentenced to a prison term will go back to prison. 52% of the entire sample will return to prison at least once, often 2, 3, 4 times. Is there a solution? Yep, there is. At Red Door, we've been doing this for a number of years for our clients who have received prison sentences or community-based sentences for crimes committed directly resulting from addiction. And this means they come into our main house initially for an addiction recovery program, then into a transition house. Now, these houses are nearby and they're managed, which allows ongoing connection with Red Door. And we work on the Reset program for these clients, and that involves a reintegration. It means severing past social networks. In some cases, that may mean a decision they make to leave a gang. It involves reconnecting with family and with good, positive social connections. And ultimately, it's things like getting a license and getting a job, getting off the benefit. There are a few very powerful reasons why we believe that the Reset for Life alternative for prison is a solid and good idea for taxpayers, for the community, for families, for the individual. So what happens? What actually happens in our prisons, particularly for a young person, first time? There's a chance that they'll be indoctrinated into poor ways of thinking and decision making. They'll make new connections, which are not necessarily good connections. We have to be honest. We are very aware that there is drug use in our prisons to varying degrees, but the fact is, prisons are not drug-free. There is the chance of being subjected to violence and bullying at a fairly high level. And all of this is a sort of a soup pot, recipe for recidivism. What happens when they come to the end of their sentence? WINS will give them $350. So what are they going to do with that? Sometimes they'll walk out with a bag with minimal possessions. Where are they going to stay? And where does that $350 go? And it's not without irony that $350 is currently about the going rate for a gram of methamphetamine. It's pretty easy to see with that sort of recipe that the chances of returning to prison and no changes to lifestyle are going to be a result. The social benefits, as we've mentioned, of people in recovery coming off their addictions and transforming their lives are immense. Families reconnect, parents are reconnected with their children, and people ultimately come off the benefit and get into work. That is so important, and it's such an important part of the program we're currently doing. And we're getting pretty good at helping people find jobs and getting driver's licenses and so on. So there is a benefit for taxpayers, and it's pretty significant. If we were to roll this program out, we're looking at a saving to taxpayers of around $60 million per year. And then you add the cycle breaking aspects to that based on a 60% success rate, which we are achieving. Staying out of jail, you can add another $36 million. That's roughly $100 million per year savings to the taxpayer. That's pretty significant. But it goes a lot deeper than that. If you start taking into account future generations in that family who are kept out of that cycle, the savings financially would be significantly more than that. On that basis alone, we should be doing that. So how are we going to make this happen? We have had some fairly good responses from the government to date. We have a meeting planned in about 8 weeks with the Minister of Mental Health and Addictions. I've had a really good meeting with Shane Retty, the Minister of Health, and I've had communication with Paul Goldsmith, the Minister of Justice. Now, all of these people, plus the Minister of Corrections, will need to be involved if we're able to make this happen and progress. So how do we progress? It has to be well thought out, and it starts with a small amount of funding from government or somebody to do a deep dive, as they call it these days, a deep dive analysis of the program, and to get an actual value in cost savings to the taxpayer if this program were to be initiated. Following that, we will need to set up a trial, and as we're based in the Wellington region, that would mean forming a relationship with Remataka Prison and doing a trial over a 2-year period with a single resource in New Zealand. This should be able to be funded from existing funding streams, and the current government has stated that they will be bringing back the Proceeds of Crime Fund, and in our case, if we were to receive that funding, it will be totally accountable. I'm not sure that's been the case in the past, but ours will certainly be meticulous accounting. And then 24 months later, we look at that whole 2-year program and that trial setup and evaluate it. And we think it will be successful. And at that point, we roll it out with 4 or 5 or 6 identical programs throughout New Zealand and maintain that low client number model through the rollout. In a nutshell, that's Reset for Life. What we really need now is support. And as I've said, the current government have been pretty good in communicating with us, and we look forward to that continuing. But we need public support. We need you to share this if you believe in it, and want to support us, we need you to share this video, maybe talk to your local MP, and just help us not agitate in any way, but promote this idea, which we've spent a lot of time working on, a lot of time thinking about, and we feel absolutely confident that this reset for life, the alternative for lower level prison sentences that are addiction related, is going to be really good for Aotearoa New Zealand on so many levels that we need people to spread the word. Our ethos, e moana puki puki e kenga te waka. Our stormy seas can be navigated.